Rant, Part 6, Patient Satisfaction Madness. Hi, it's Mike. How are you doing? I hope you're doing well. Thanks for coming by, and it's good to see you again. This rant will be a quick one, and it's about patient satisfaction madness. Here in healthcare, patient questionnaires, patient surveys, patient forms, they're everywhere. Where I am, they're all over the place. People want to know how patients are being served, and if they're being served well. At a basic fundamental level, that's a good thing to know. You want to make sure that the staff, they're treating the patients properly and they're treating them professionally. But what has happened over the past 10 to 15 years is that it's just been a madness. I mean, it's just, damn it, madness. I mean, it's crazy. Doctors now can't, they have a hard time practicing the way they want to practice medicine because you've got 200 patients that will, turn in bad reports and they openly threaten us. They just openly say, well, when we get the call or we get the card or we get the email or whatever, we're really going to trash you and we're going to fix all of you. And unfortunately, with many healthcare plans, the level of your reimbursement is tied to your patient satisfaction scores. As a result of that, many doctors are walking really on eggshells, and they have to be very careful, along with the doctor staff. They're not too happy either. The thing is that what has happened is there's a real push toward patient satisfaction. There's not a real push toward medical excellence or medical, correctness, where things are supposed to be done properly and where the doctors can get, a chance to practice medicine the way they, want to practice medicine. But what has happened is it's just about turning everything into a wonderful patient experience. It's just like you get those drug commercials you see on the tube. Everything is wonderful, and it's just this beautiful place with sparkling butterflies and beautiful oceans and mountain vistas and the whole thing. And as we all know, life isn't like that. But what is happening is with this forceful push toward patient satisfaction, many times people are getting over-medicated. They're getting over-tested. They're getting very, very problematic situations because doctors want to make a paycheck just like everybody else. And they have to be very careful with how they deal with patients because patients will, like I said before, patients will openly threaten you. And they will openly tell you that when the Press Ganey comes out, and they know about Press Ganey too, and they know about the little cards and the little emails that they get, and they know about the patient surveys, and they know they can get you with them. Trust me, many patients are far smarter than one might think. Many of them are just downright cruel and vicious bastards, but that's another story. Many times now, doctors have to really, really be careful. And in many cases, there are problems where there's just over-medication, there's, over-treatment. And the thing is that many of these patients just don't have the sense to see that this is not helping them. Getting what you want is not necessarily the best thing for you. And many people will find this out as time goes on. What the correct thing to do is the correct thing to do. It may not be the popular thing to do. It may not be what is desired by the patient, but what is correct is what is correct. And that's the correct thing that should be done. It's driving up also this whole patient-centered philosophy is also driving up healthcare costs and making healthcare even more expensive. Here in the United States, we have a $3 trillion healthcare system. And that is not good for anyone because a lot of people, because there's just not enough money to go around or not enough money to go to the right places, that is. There's not enough money to go to the right places, so many people still can't get proper health insurance. And this is all a part of it. That's what I'm thinking about right now. I'm going to go into this in more detail later on, but I just want to bring this up very quickly. Now let me know what you think about it. You can email me or put it in the comments. That's all I have to say for this topic. But I just want to close with this. Just because you want something does not necessarily mean it's the right thing for you or the best thing for you or the proper thing. That concludes what I have to say for today's rant. If you like what you've heard so far, please subscribe, like, and comment. Take care and be well.